So hi guys, welcome back. Today we're going to be talking about malaria. So malaria parasites are usually transmitted by a bite of an infected female Anopheles mosquito. That is Plasmodium falciparum. Is the commonest breed in Kenya and is associated with significant morbidity and mortality rates. So the other species are Plasmodium malariae, Plasmodium vivax, and Plasmodium ovale. So clinical features include paroxysm of fevers, chills, rigors, and sweating. So other features include malaise, headache, myalgia, joint pains, refusal to feed, nausea, vomiting, abdominal discomfort, and diarrhea. So severe malaria presents with anemia, that is HB less than 5. Cerebral malaria manifests with confusion, stupor, convulsions, or coma. Also, jaundice is another presentation, hyperpyrexia, of that's temperatures of above 39 degrees, hyperglycemia, sugars of less than 2.2, pulmonary edema, disseminated intravascular coagulopathy, DIC, that is spontaneous bleeding. Also, malaria, hyperglobinuria, that is Coca-Cola colored urine, that's highly concentrated. Oliguria is another factor, hypovolemic shock, and fluid electrolyte imbalance. So investigations that a patient presenting with such clinical features, we do a thick blood smear for malaria parasite. So several slides are very important so as to be able to rule out. For an inpatient, we have to do normal lab works, that is hemoglobin, blood sugar levels, and urinalysis. So we do a thin blood smear for parasite count, species identification, and random blood sugar. So a negative slide does not necessarily rule out malaria. Where cerebral malaria is suspected, we begin appropriate therapy promptly. So we exclude other diseases such as meningitis, which may present with similar features. So do not assume any positive slide explains the cause of a febrile illness. So 20 to 30% of normal population in the endemic parts of Kenya will have positive slides for malaria parasite without any symptoms and signs of malaria. So if the symptoms present this way and the slide turns positive, what are we supposed to do? So the current recommended treatment for patients with uncomplicated malaria is a combination of temmeter, lumefantrine. This is available as a fixed dose combination with tablets containing 20 milligrams of atenomil and 120 milligrams of lumefantrine. So treatment of adults with a 6 dose regime of 4 tablets start, then 4 to 8 hours to 24 to 36, 48, and 60 hours later on. So should a patient deteriorate clinically at any time or symptoms persist for 3 to 14 days consecutively after initiation of the treatment, this is considered as a treatment failure. So we treat such patients with quinine tablets, which come in 200 milligrams or 300 milligrams preparations, and the dose is approximately 10 milligrams per kg of body weight, 8 hourly for 7 days. So recommended second line drugs are dihydrotesamine plus piperacin, which is the next line in case of in any complication or unresponsive to medication for malaria cases. Thank you very much.